Right, I make it 6:30, so I think we'll get started. So evening everybody, if you can hear me, perhaps if you could just pop into the chat that you can hear me, just say yes, and we'll know that the recording is brilliant and we know that it is working okay. I do like my technology, but you can never rely on it. I've always been this convinced that technology knows when it's important. Just when you want to photocopy a lot of handouts, that's when the copier has a bit of a funny turn. So hopefully it'll be our friend this evening. Thank you, I'm glad you can all hear me. Welcome everybody. We are expecting quite a few more people. Well, it may be that they've registered for the webinar and not intending to watch it live, which is absolutely fine. It takes the webinar software a little bit of time to upload the webinar to the cloud. And then when it does, we can then make it available to your group. So don't worry, if you do need to drop out tonight, if you've got a better offer, a pressing engagement and you need to leave us, then don't worry, you will be able to watch the full recording. Sometime I hope tomorrow when hopefully technology plays ball and sends the recording through. So I'm sat here this evening in very dark Redditch. I've got my gin. It was my birthday on Monday and I had a beautiful bottle of gin from my husband. So I'm drawing a gin and tonic with you this evening. And given the topic we're about to talk about, I guess many of you will have you know, added another 40 bottles of something white to your order this week. Make sure that we don't run out. And also perhaps joining me for a drink this evening. Oh, thank you, Rebecca. Yes, it was a lovely birthday. And of course, it was James's yesterday. So of course, it's been nothing but birthday week this week in our house. But yes, it's been a lovely week so far. So everybody ready? We'll get started. So obviously I need to do the regular disclaimer. If anyone's got their audio on, if they could just mute themselves, that would be fantastic. Yeah, regular disclaimer that we obviously have to share with you that obviously this is general guidance this evening and it's not specific advice on your specific situation. Please always seek advice with any aspect of HR, employment law, managing people. If you're at all unsure, always better to be safe than sorry, as they say, and always better to check it out. No questions are silly questions. So this is me. So as I say, if somebody could mute their sound if they've got mute on, that would be fantastic. So this is me. I am Managing Director of Red Wing Solutions. We are a HR and training company based in Worcestershire, and we've been trading for 16 years in May. We are specialists in HR for early years. So we work with day nurseries, preschools and out of school clubs across the country. We do have other customers as well, just for a bit of variety. We'll take anyone's money, we don't mind, but we do specialise, and most of our customers, I think over 75% now, are actually day nurseries or preschools or out of school clubs. And so yeah, we're a busy little team. There's only 5 of us, and we, as I say, you know, love speaking to the early years audience. And so obviously when I saw that you'd got a group that obviously I knew you'd be talking about one topic this week in the group, I thought I'll offer Joe an opportunity for me to come on and provide your group members with this webinar this evening. So hope you're going to enjoy it. Hope you're going to, you know, find it useful. It's not particularly an enjoyable subject actually, Imogen, is it? But I hope you find it useful. I suppose that's what we can say. And that hopefully from the point of view of the employment of people, that hopefully this evening will answer some questions that you might have. And I know some of you have posed some questions for me, which is wonderful. So thank you for that. But if you do have a question, you can pop it into the chat facility and I will refresh that and be able to see it. Oh, thank you, Joe. You're very welcome. Yeah, pop it into the chat and then we'll be able to, you know, answer those if they're not too long and be able to answer any questions you have as we're going through the information this evening. Let me just move that out the way. We'll pop that up there. Oh, that wasn't helpful, was it? I disappeared it already. There we go. Let's make him smaller. There we go. Right. So by the end of the webinar, we'd like you to understand the possible impact that coronavirus may have on employers and employees and how you can manage it. understand the consequences of your actions in relation to your thoughts on how you're going to manage that impact, because this very much is about thinking ahead. Well, as we said to a client today, what we need to do is obviously prepare for the worst, but hope for the best. And that's very much, you know, what we message that we were trying to get across this evening. Now, there's one place that each of you need to, I guess, have a daily visit to. I know you have specific advice for educational environments and that sort of environments, educational and early years environments. But the overriding portal, if you like, where the government will put out all the information for the public. So rather than going to the news sites, which obviously, you know, again, great that we've got 24/7 news these days, but, you know, news sites obviously might stress certain things in certain ways for certain reasons. But you can have the direct from the horse's mouth, if you like, advice by popping onto the government website on a regular basis. So we follow this link. You will go to the government's coronavirus webpage, and you can see that it is updated every day. I'm told it's 2 o'clock. Personally, I think it's 8 o'clock in the morning, but I'm told it's 2 o'clock and that they do the update. And obviously today we've had the news that we've had a big jump. So we've gone to 115 confirmed cases, and ultimately all your information is there about obviously where the cases are, what the risk level is, information about returning travellers, which I know we're going to speak more about this evening, and obviously, you know, what to do if you need to call somebody. And the key message being, please don't go to your doctors, please use the 111 online coronavirus service. And obviously there is the facility to call 111, but I think as people have seen on the television when they've actually been talking to the call handlers and to the managers of those call handlers, and we have one of the NHS 111 centres not terribly far away from us in Dudley, they're getting such a volume of calls that they'd prefer you to be using the online facility rather than ringing. But, you know, as I say, I think that facility still exists. So obviously that's one of your choices to make. So this is the website, as I say, that I think you should be looking at for all your information. So it's got your lockdown areas, you've got guidance based on directly from the Chief Medical Officer, you've got information about what it actually is, that this is a virus, not a bacteria. You've got your government's action plan, which was announced on Tuesday. And we've got information, as I say, from Public Health England and from the Chief Medical Officer. So this is a good website for you to be visiting on a regular basis. And so definitely one that I would recommend you keep in your links. Perhaps you can set it up so that you can have a check of it on a daily basis. So one of the phrases that I like that I've heard recently since this whole crisis began is this phrase, control the controllables. And I heard this on the radio, and it was the English Rugby Union boss. I'm not big on rugby union, but it was an English Rugby Union boss talking back end of February about the potential for the England-Italy match to be postponed in March. And so he basically said, look, you know, all we can do is continue to do all our training and control the controllables. And I really think it's a lovely phrase, and obviously makes a lot of sense as to where we are. You won't be able to control everything, but you can control some things. So control what you can. And obviously, you know, that's, if we don't want people to get stressed and unwell by coronavirus. You know, I had reason to visit my parents this morning, and both of them were very, very worried and concerned about it, because obviously all they're doing all day, every day is watching the news, and they're concerned about James's GCSEs exams. They're concerned about our holiday to America. They're just concerned. And obviously we can't control whether we will fly to America in June. We can't control whether he will sit his exams in June. But he's going to continue to do his revision on the basis that he will, you know, so you can control only what you can control. And this is another phrase I like, don't panic, just take logical decisions. So, you know, we do need to be prepared, and we do need to look ahead. And as I say, think about what could happen. And then obviously, you know, understand what the government's saying is could be very, very bad. But let's hope for the best. But, you know, let's let's take some logical decisions and some sensible moves, and not lose our minds over it, because that will make us ill, let alone if coronavirus lands at our own personal door. So as of the 2nd of March, because obviously I had to prepare this presentation for you this week, these figures are now 2 days out of date, 3 days out of date. But, you know, you're talking thousands of people who have been affected, that in terms of where we are in a few weeks, we're going to have 1 in 5, according to the government, off potentially at the peak of the outbreak. And the outbreak could last 6 months, it could be delayed by summer, it could come back, they just don't know. But the idea of 20% people being absent, I think does for most people, 20% absenteeism would be an unknown entity. You've never had 20% of your workforce out at any one time. So it's obviously something very much to be worried about. So cases of coronavirus across Europe. Well, we talk about the phrase pandemic. You know, in terms of the World Health Organization, they no longer use that term. So it won't be something ever labelled as a pandemic for the purposes of what was used to be previously labelled as pandemic. But it's definitely going to be global. And in many ways, I expect on the next news, they'll talk about that it's going to be classed as an epidemic because it's spreading itself. But if you look at the areas where it's actually, as I'm saying, this is as of Monday, you look at where they actually consider the areas to be most at risk. You've obviously got the areas where actually there's more cases. And so the darker the colour, the more the cases. And again, this is obviously changing on a daily basis. So obviously we wouldn't be that shade of pink as the United Kingdom as of tonight, but obviously we were on Monday. But in terms of obviously the rest of Europe, that, and obviously that's going up as well. So there's been a lot of talk about Italy. And obviously we can expect there to be a lot of talk about Italy. My favourite so far has been I may have got off with an Italian at the weekend. My mates think I did, but I wasn't sure because I was drunk. Do I need to self-isolate? I love that. I love the may have got off with an Italian. I just love all of that, to be fair. You know, there's nothing you can't love about that. And only in a nursery would you be asked, you know, do I need to self-isolate because I've snogged somebody from Italy? Yes, absolutely love that question. But yeah, you can see, and it's well reported, isn't it, in Europe, that Italy is a hotspot. And there's been lots of talk about people coming back from skiing holidays. And obviously in northern Italy, that's very popular. And obviously it's impacted schools where they took their pupils on skiing holidays over half term. And then obviously people then have felt unwell on their return. And that's resulted in people obviously being tested. And whilst they've tested, in some cases, they've closed the schools. So obviously it's very much a Europe thing now. It started off as just China, it's now Europe. And you've got obviously again from Monday, details of how the daily cases have obviously steadily risen and are now still steadily rising at the same rate. So again, more about Northern Italy. So Public Health England advice at the beginning of this week, that obviously if you were showing symptoms and you have travelled from Northern Italy, you should self-isolate. If you've come from a quarantined town, which is obviously all those little red blobbies, then you definitely have to self-isolate. Just admit David. So yeah, I mean, we had a conversation, I think, with a nursery owner earlier in the week, and they had got somebody who had flown in, I think, what would have been tomorrow, a week ago, Friday, from Verona, which obviously isn't one of the towns that is listed. And they had suggested to the person who'd come into contact with them that they were told to self-isolate and that they had actually been tested. They then went on to spend the weekend at that person's house, you know, ate meals with them. There's lots of people came around, so they clearly were not self-isolating and, you know, behaving as their self-isolating person would. And then obviously, you know, come Monday evening, there's concern being voiced by the apprentices' parents that really the employer, the nursery, ought to give them time off work on paid leave because they will have come into contact with somebody who's travelled back from Verona. So as I say, you know, our question at that time was, okay, so they're saying Verona, which isn't one of the cities or towns, and they're non-symptomatic. So there shouldn't be a problem. And we'll talk later about what you then do if you then decide, well, okay, so they shouldn't be self-isolating if they're not symptomatic. So that's not the guidance. So if we then give that person paid leave, what are we then doing in terms of putting our stake in the ground for future cases that may be down the road? Oh, Keith's put a question. Nice, yeah, thanks, Keith. Oh, that's good. That's an update then. A few hours ago, all of Italy is now in scope. So again, yeah, all of Italy, doesn't surprise me given the numbers of cases in Italy. So we're now going to be thinking about anybody who is travelling back from Italy may need to call 111 for information about whether they should self-isolate. And our understanding, and we're going to talk about it shortly, is that 111 is going to be the people who are going to, or a doctor, if you do see one, but I'm not sure how you're going to see a doctor, 111 or a doctor will be telling you whether you should or shouldn't self-isolate. So it isn't going to be somebody who's just making that decision without advice. They should be seeking advice and following that advice that's given to them. So it is a changing picture, Keith, as we've been saying, isn't it? Absolutely a changing picture. So obviously there's a lot of talk, isn't there, about why are people losing their minds when actually more people die of flu, which I think you'll have all heard. Well, obviously there's been studies to suggest that right now the percentage of death rate is quite a bit higher than would be expected. They think it'll be settle out at perhaps about 1% of reported cases, but right now figures are suggesting it's more like 3.6, which is a bit more worrying. But obviously in terms of deaths, you can see, look, the last two cases that are all based on SARS, really. Coronavirus is based on SARS, as is MERS. It's much more serious than SARS and MERS were, that I think barely we heard much about when we had obviously an outbreak of SARS, mainly based again in China. So symptoms that may develop. So again, you'll have all heard people cough and then apologise in the last few weeks, and this is probably why, because obviously the symptoms that people expect to be significant and suggestive of COVID-19 are a cough, a fever and difficulty breathing. And obviously these things obviously are, you know, not necessarily someone having a heavy cold, not to be mistaken for just a seasonal cold that you might expect people to have at this time of the year. And obviously there is understanding, I think, that children aren't particularly susceptible to this problem, but in terms of obviously the older people, people who've got a pre-existing condition, so people with respiratory problems, COPD, that sort of thing, equally people who are obviously under the doctor anyway, with cancer and lung disease, diabetes, people who have been immunocompromised, those are the people that they really worry about. They say that after 40, you've got a higher risk of being impacted, and then it jumps again after 60, which I think as any 40-something-year-old, I was very pleased not to hear this week. But ultimately, as I say, adults probably will have quite a mild illness and then recover. But obviously, it will be, for you as employers, it may not be the duration of the illness itself that causes you concern, but obviously the period of isolation that is brought in to contain the spread of the illness that causes you more worry. So yeah, obviously these are your symptoms to look out for. And you know, we have put in our coronavirus policy this week, obviously what you should do if you became unwell at work. And all of us should be thinking as employers about where our you know, isolation location will be. We've already identified that it's our broom cupboard where we will go should we feel unwell, and obviously seek advice from NHS 111. So let's just talk about self-isolation. So obviously people are being advised to self-isolate. They're being advised to self-isolate whilst they're awaiting a test, which we understand in some cases can involve attending like a drive-through centre where somebody comes out to a car park and actually gives you a test whilst you're in your car. You might be asked to self-isolate if you've had close contact with a confirmed infected person. So remember, with every case, they're still doing all that tracing to see who you've come into contact with. And my understanding is many of the people who have contracted COVID-19 are the family members of people who have returned with the illness and with the disease, and then they've obviously passed it on unknowingly, should I say? I don't know, it might have been willingly, unknowingly, to their loved ones. And obviously those are the people who are now infected in many cases. So I think there's, again, we have to watch the media to see whether they're going to update us as to some of the other cases, as to whether it's actually been passed from, you know, person to person with people who haven't returned, or don't know people who've returned. So how have they got it? Obviously the places affected by the virus, obviously that would take us back, it's a link that would take us back to obviously the web page that has that information. Oh, thank you, it has. So as you can see, returning travellers, if you've travelled to the UK in the following places, even if you don't have symptoms, so if you're a family coming back from Iran or Hubei province, which obviously, you know, good luck with that, because obviously there's not very many planes coming out of there. Lockdown areas of northern Italy, which is now Keith is saying is potentially all areas of northern Italy, and obviously special areas of South Korea. And then stay indoors if you've travelled and you have the symptoms. So a cough, high temperature, shortness of breath, even if they're mild, and you've got all of your listed areas. So you may well have families in your setting from Malaysia, from Thailand, Singapore, Hong Kong, I've heard of, and as I say, you know, plenty of people go to Italy and have plans to go to Italy in the coming months. So yeah, that's going to be a real issue, isn't it, for us, that Italy is particularly an area of concern. So that's obviously something we've got to watch the space for. Yeah, I'm going to answer that question shortly, Rebecca. One of my lovely customers is on this evening. So thank you for Rebecca for asking that question. I will be with you and answer that one pretty shortly. So self-isolation. So if somebody's suspected of having COVID has been in your nursery, which obviously would be your workplace and your worry, obviously, you know, if that's the concern, you're going to obviously contact NHS 111 on your Public Health England. You're going to obviously go to them and ask them what they want you to do. Obviously, somebody needs to be tested before obviously you make any assumptions that they are infected. And obviously they don't advise any workplace to close just because somebody may have been in your workplace who may well have been exposed. But I know that some places have done that, and especially schools. And obviously most possible cases turn out to be negative. So you don't need to take any action until you actually know what's going on. Those who've had close contact will be asked to self-isolate for at home, and we believe that they get given what's called the home isolation advice sheet. So again, if you follow that link, this is what that looks like. I don't know what form they get it, whether it's a question of they're told that go to this website and type this address in, but you can see this is written to you. So your health team have told you that you should wait at home for results. If you can all see that, let's just move that to one side. Hiya, Vivienne. So we will answer that question shortly. I think it's a good, very good question, and something I was thinking about as I was pouring my gin. So yeah, your local health protection team and your doctor have agreed you stay away at home whilst the results are known. This is because you do not need to be admitted to hospital because you've agreed to follow the important instructions. So this is obviously what stay at home means. Do not go to work. You'll need to ask for help with online shopping being delivered at your door. I do wonder, you know, if we end up with a massive outbreak, whether Amazon will manage to, you know, be as popular, because obviously they don't want to be off work, the Amazon delivery people, because they don't get paid if they don't deliver, do they? So that's a prime example of the gig economy, if ever there was one. Obviously putting a sign on your door to say, I am unclean. No, sorry, I have got coronavirus. Separating yourself from other people. I understand things like if you live in if you've got one bathroom and you have to obviously use the bathroom, you use it last. And obviously it's then cleaned afterwards. They've got separate towels and things like that. You know, even silly things like in our house, you know, you think, oh gosh, I think I've just used the same towel as someone else. And so, you know, this week I was like, right, okay, grey towel for for me, black towel for you, don't touch my towel. You know, and those are simple things that you just now become aware of, don't you? And obviously don't share kitchens without obviously, you know, making your own meals when no one else is present, and then using it back to your room to eat, using a dishwasher, probably on the highest setting. They advise us to use our dishwashers every day, which, you know, has always been the issue in our house. So don't say, well, that's new news. And then obviously this thing about washing, separate tea towels, separate towels, and that sort of thing. And obviously don't visit your doctor beforehand. If you've got a face mask, then obviously wear it. I understand face masks aren't a lot of cop, apart from potentially if you were to cough, your coffee fluid doesn't leave your mask, which is all good. And then obviously covering your coughs and sneezes. So make sure you've always got tissues, and then obviously double bagging your waste, because if you are confirmed to have COVID, our understanding is that waste will not be put in the recycling machine. That waste will actually be removed from you, from your home, and removed from you. So that's what we understand will happen. So they'll be obviously followed up by the health protection team, because people need to know who people are and whether they do go on to develop it. They will obviously become unwell if they do become unwell, and if they're obviously unwell at any time, then obviously they'll become a confirmed case. And then obviously cleaning. Coronavirus is similar to that flu illness, that high temperature, feeling rubbish, cough, the fever, the shortness of breath. Obviously any surfaces that somebody's had come into contact with must be cleaned. So you'll hear of obviously hard surfaces will store a virus longer than soft surfaces. So, you know, the virus can live on, you know, metal rails, door handles, probably keyboards and computer monitors, things that you might have, as you say, coughed onto for some time. And so obviously those all need to be cleaned, and obviously anything that's contaminated, decontaminated. Public areas, if somebody who is symptomatic passed through, even corridors. So if you've got an isolation area, as I say, that we've identified, then you suggest that person, when they enter the isolation area, avoids touching anything. And obviously then it is obviously disinfected. And obviously if the person becomes ill in a shared space, then using disposable cloths, alcohol-based wipes, and obviously disposing of the evidence. Like a crime scene, isn't it? The way we describe it. So, preparedness. So things you can be doing in advance of obviously how this might go. So, you know, one of the things that people are considering doing is obviously having no unnecessary visitors to their setting. So cancelling show rounds, thinking of alternative ways to you know, show your setting to potential parents, whether that be obviously through use of technology, like having a video call and sharing them with a camera, what we actually do and what you can see, and having a chat with people that way. They may be cancelling recruitment events. If you do have a recruitment event, obviously there's nothing to stop you holding it outside of your nursery. But, you know, getting big groups of people together may not in the future become advisable. So you might need to do it on an appointment basis to limit the number of people. And that's the same for open days that you might have, celebration events. A bit too early in the year, isn't it, for fates and fundraisers, but that sort of thing. Not going to care homes with the children, because obviously I know a lot of you do that, which is lovely, but obviously that is the group that is obviously most at risk, and so care homes themselves may well not be open to visitors sooner than other facilities like yourselves. I heard this week of obviously a nursery that was asking parents to hand over the children at the door. I mean, you know, when James was little, I could have let you hand over me child to me at my front door, let alone your front door. But yes, that's a new one. I guess that's going to be, again, some parents well received, other parents are going to like that one like a lead balloon. But yeah, that's a strategy that nursery has adopted in order to, again, minimise having unnecessary people in the door. I don't think it would work with Mrs. O. I don't think she would particularly want to be told that she can't come in. But, you know, brave any nursery that tries it. Installing hand gel entrances, more and more common. I guess that's if you can get hand gel. And remember, it's got to be 60% or more alcohol to have any use. And putting up signs and educating people on everyone on hand washing. which is by far the best way of obviously reducing the risk of infection. Before you eat, have you washed your hands? Before you touch your face, have you washed your hands? And if you can't get hold of wash, if you can't do a proper wash to the sound of happy birthday twice, which obviously we've heard a lot of this week, then you do need to obviously use hand gel just to give you that extra level of protection. Oh, I think I've just scooted past. So how ready are you? Are you prepared to be impacted? So again, one of the things I would say to do to manage the impact of coronavirus would be to think about, you know, should the worst happen, how would we manage? How would we cope? So do you know how to do your own payroll? Here's an example. What if your payroll bureau shut down because of COVID-19? Would you be able to meet payroll yourself by your own means? Have you sat down with somebody ever and seen how to do it? Would you know how much money to transfer if you then needed to do the payroll separately? Have you got a contingency plan, if you like, when it comes to payroll to enable you to keep people's money coming in? Because one surefire way of upsetting your staff is obviously not to make payroll. Do you have a set of passwords for all your portals, whether it be for funding, whether it be for accessing you know, things that you need to log in to change on the back end? Do you have somebody who does those things, who's great and has all those passwords in their head, but actually has never thought to put them down somewhere? And should anything happen to them, should they become taken ill, and let's think about it, you know, people might not just be self-isolating and contactable, they could be ill. Would you then be able to, you know, get hold of their passwords? Would you be okay if you had to wait get hold of their passwords? Or is it now the question of asking for those things now and thinking about where you're going to put them, sorry. We've been doing that in our office. So we use the cloud for all of our information about how we do things and how they work. You know, obviously that wasn't the case with business continuity many years ago. They had to have a box on the drive, I understand, with a special key, or people had folders in the back of cars in case they ever couldn't get to work. But, you know, these days you can store things in the cloud and people can have access to them away from the workplace should they need to. And that's something you've got to think about in terms of, obviously, when we talk about people perhaps working from home, if there is any work that can be done, you know, could they access that from their own computer, laptop, their own PC, their own iPad, with logins that obviously, you know, you may well have created. Another thing to make sure you're ready is obviously our contracts of employment. I'm going to ask you a poll question. Here's your poll question. Oh, this is very encouraging. So many of you have had contracts created for you in the last 12 months, which is fantastic. In terms of obviously what that might mean, 82% of you saying yes, they have. You do need to check them. I was speaking to a lovely lady on the old internet before we came on, and she said that she'd got some that had been produced for her small, I think it was term time only environment, and she'd looked and she didn't actually have the short time working layoff clause, and they were prepared by one of the big boys whose name begins with P, and I shan't say any more. So quite a surprise to find that they didn't have what they need to have. So always looked. I'm of the theory, if you're going to find a short time working layoff clause, it'll be the back end of the contract. It's not the first thing you tell somebody when you give them a contract. It'll be the back end, and you are looking to see that contract in place. If you've got it in place, then, oh, hi Sharon. You've got it in place, then obviously you can be confident that you will be able to have more options going forward that we're going to talk about in a minute. Will your parents be charged if you're forced to close by your local authority or by Public Health England or by anybody else? We could expand that sentence. You know, what's going to be your strategy with your course they do, Louise. How dare you? Have another sip of your Diet Pepsi. Yeah, if you're going to charge, and there's a lot of debate about this, isn't there? I mean, yes, I can absolutely understand why you would want to have in your contracts between yourself and your parents that obviously if you're forced to close, you'll charge them. And you know, I totally understand that. I totally also understand the people say, I'm not comfortable with that. And I think it has to be an individual owner's decision. But in terms of obviously their ability to pay, I think what we've all also got to bear in mind is that obviously if you charge people for a nursery place, but their employer has not paid them because either that employer is saying, look, you're on unpaid authorised leave because your school is closed and you are, you know, your nursery is closed and you've had to provide childcare for your children at school and at nursery, and or we're not going to pay you. That person's ability to then pay you is clearly compromised. So I can really see how this could be really problematic. And I suppose one of the most upsetting things this week has been the news that insurance isn't what you think it is. Now, I don't suppose that's headline news to anybody, but I think, again, that's quite upsetting to think that, you know, people's insurance is not recognising the terminology of notifiable disease, you know. But hey, I suppose that's for other people to more qualified in this to talk to people on that. That's a good idea, Blue. Yeah, we'll do that in a minute. I'm not too good with the polling, but I'll definitely do that at the end. I'll remember to do that. And so you can get a picture of who's going to do that. So do those who could perform work at home have the means? So again, I suppose this is something we have to think about. If you were going to close rather than, let's not talk about self-isolation now, but if you're going to close, and obviously because you've been told to, then, you know, you would want people to work from home in order to receive their wages. So in that situation, are you going to be able to get them to do some work? Now, my understanding is, and you know, you will correct me if I'm wrong, but, you know, obviously you can have online learning journals, which potentially you could allow staff to take an iPad home that they then abide by your policy and procedures in terms of its security and what have you, to update those online learning journeys whilst they're not available to attend work. You could have potentially a situation where you might have to seek permission in order to take children's work home. Now, you know, in a situation like this, again, it might be worth your while seeking that permission and seeing if that could be permissible to you. You've got work that probably needs to be done, and absolutely you can ask people to work when you are closed in order to make sense of why they're receiving pay. People have to cooperate with that, and again, I think you'll find out who your real stars are if you were ever to be in that situation, as to who, you know, absolutely can do work from home and basically wants to do anything they can and understand the situation, and those who don't. So what could happen? So you could have staff absence because they are self-isolating. You could have staff absence because of schools being closed, because as we know, a lot of people who work in a nursery will have children of school age and will be potentially needing to be at home to look after their older children. They already have children in nursery, but they're older children who are in school. You know that you may have staff absence due to anxiety over coronavirus, and you could obviously be told to do a deep clean. So what happens, but we hope it doesn't, which is obviously the social distancing strategies. Crikey, the time's already 10 past. School closures, banning of large-scale gatherings, making sure that obviously people, you know, where they can homework. I'm not booking anything unless it's on a credit card. You know, it's just not worth the risk because you might find you're cancelled because they can't do it. School closures are down the list of options apparently because obviously children aren't at the risk of being badly affected by it, but they are known to be super spreaders. And obviously school children may have parents who work in hospitals, and hospitals don't want to have staff off. So that could be another deterrent to close schools as part of a social distancing strategy, or at least we've got to hope so. So, question, would it be legal for me to cancel employees' annual leave because of the impact of staff absence on the business? So in these questions, I'm going to try and answer your questions as well. So not nice to cancel a holiday. wouldn't want to have to be in that crappy situation as an employer, to be fair, but the law does allow employers to cancel holiday leave that has been authorised, but you have to give the minimum notice period. So if you are going away for a week, I have to give you 2 weeks notice. It's the same as if I was to make you take holiday, which again, we can do. We can enforce holiday as an employer, as long as we've got it in the contract that we reserve the right to fix holiday. We have to give double the amount of notice of the leave we want someone to take. Somebody's question was in relation to holiday. Yeah, Vivian, in terms of your question, if an employee chooses to go to Italy and then they have to self-isolate when they return, does SSP still kick in? Yeah, because if you're self-isolating on NHS 111's advice, then you are sick for the purposes of statutory sick pay. So yes, I mean, one of the questions that has to be asked is, you know, to knowingly go to somewhere that you have to be off when you are returning. And it's, again, probably not a question for this evening, but it's definitely something I'm going to take back to the office tonight if what you're learning, Keith, is correct. You know, how reasonable is it for you to travel to a country that means that you are not going to be able to return to work from afterwards? You know, that's a whole area of employment law in terms of the reasonableness of the parties' behaviour, and definitely worth looking at, because obviously employees should always be mindful of their own safety. They have a duty to themselves and others, don't they? So to put themselves at risk is potentially a bit dangerous, isn't it, really? But something we can't answer tonight, but we will be answering because I think it's an important question. Question 2. What would we pay staff who are required to self-isolate following advice? So again, treat as sickness absence and pay SSP in accordance, in accordance with the regulations. And obviously, this leads us naturally on to what happened yesterday, which is that dear old Boris stood up at 12:30 and announced something that I don't think any of us potentially saw coming, which is obviously the idea that you will receive SSP from day 1. So that is the link to the one about, obviously, information about self-isolation, which we looked at last time. So what would we do if someone refuses to come to work? And obviously that could happen through fear. They could be worried and therefore not want to come to work. That's quite possible. Where's the answer? Basically, the advice is that you talk to them, you explain the government advice, you reassure them. They're not entitled to any pay if it's just a refusal. That, again, you might decide to give them authorised unpaid leave rather than push and push. But ultimately, you know, if people say, I'm not coming to work, as I said earlier, I think I've snogged somebody who might have had it, therefore I'm not coming to work. And I haven't rung NHS 111, and why would I? You can't just not come to work because of fear. But obviously, if they became unwell because of their fear, and let's think about that, stress and anxiety could easily be what they would be signed off for, then obviously you'd need to treat as any other sickness absence. What would you do if staff want to cancel holiday? Again, no requirement for you to allow that, but obviously if you can have people who obviously do want to cancel, and you have got 20% absenteeism through sickness absence, you're going to be very grateful to those people who are cancelling their holidays. So again, I would say, whilst there's no requirement on an employer to do that, what price flexibility? But they can't just expect to rock up on the day you weren't expecting them to be in. They do have to talk to you first. Question 5, what's the difference between short time and layoff? So Vivian, you asked, what does it actually do and what does it actually mean? Well, short time is when your hours are cut. So say you work mornings, not afternoons. We saw quite a lot of that in 2008 in the crash, when factories and such like, you know, decided that they needed to work just mornings. They didn't have work for all day. So obviously they basically put people on short time work. Obviously that situation is awkward, and, you know, there is potentially, you know, less likely now, but that is obviously a possibility. Layoff is where you have workless days. So you can't be treated as being laid off If you've done work in the morning, say not worked in the afternoon, that's short time. But if you've been told there's no work for you today and for the rest of the week, say, then you've been laid off. Now, there's no limit to how long you can be laid off. But obviously, if you do get laid off, you could apply for redundancy, and that can happen and cause all sorts of headaches for employers. Obviously, if you've been laid off for 4 weeks, then you're basically treated as automatically redundant. You resign and you claim redundancy from your employer. So that could be really difficult for people. In terms of laying people off, you don't have to give notice as such as in terms of a stated notice, but you do obviously have to give as much notice as possible. Layoff involves guarantee pays. So guarantee pay is £29 a day, and you can pay it on five occasions. And then once it's been paid, that's the maximum amount of guarantee payment that you can make. £29 a day doesn't seem much. And obviously it's £29 regardless of your salary, whether it's 20,000 a year or 40,000 a year, it's still £29. And if you don't earn £29, it's obviously a lesser figure. It is your lesser figure, shall we say. You have to be employed a month. As I say, if we end up in a situation where you need to consider layoff, I really strongly suggest you speak to somebody like ACAST or somebody like a HR consultant to get advice on your individual situation, because you need to choose the right one. We often talk to our clients about this idea of pressing the button. You know, you don't want to press the button and then decide you pressed the wrong one. So, you know, coming up with a plan for you that supports you and your business, and obviously helps save your business, is really, really important. Short-time working, if it's not in the contract, it's not an option. So, you know, now is the time for you to check those contracts that 82% of you said you've had checked in the last year, and make sure you've got short-time working and layoff. And if you haven't, you know, we've got options. We've got the option of obviously updating the contracts because people might be having an increase in April. So there's no better time, is there, to say to somebody, here's a new contract, because obviously we're giving you some more money, which, you know, despite common belief, that does vary the contract. And then also we've got the opportunity perhaps to do an addendum, which again, if people want to have a job, they probably will accept the fact that you need to do short-time working and guarantee payments. What would you need to do what would we do if we needed to close for a deep clean? Well, again, you could, as we say, talk about layoff and make those guarantee payments, but only if the contract allows it. And we talked there about the £29 and or less. So what can we do? Be part of the message to improve hand washing, which obviously is really important. I will come back to everyone's questions in a second. And hygiene, that's really important, isn't it, to be part of that message? Now I broke it. Keep up to date with daily developments. So going on to that government website that we looked at the beginning, as I say, it changes every day at 2. Be abreast of what's going on and what the latest information is. Make sure you reassure your parents and your staff that you are in control. Consider who you can approach for a deep clean. You know, have you got that number? Have you thought about who you would use? Would you do it yourself? Would you ask your staff to help you? Would you hire in a professional for commercial cleaning? If so, what does that mean? What's the consequences and what have you? Giving it some thought. Prepare yourself for possibilities of high level of absence. So again, you know, some of you might be thinking, right, who can volunteer to assist us to stay open? What does that mean? What's the consequence of that action? You know, what can we do to help us, you know, maintain our businesses at a time of crisis? Think about how we approach people who are anxious. Again, you know, this is all very important for staff wellbeing. People will be anxious for all sorts of reasons, often because they are not only parents but carers for elderly relatives and just scared to death at the thought of getting it. So obviously that needs to be addressed. And obviously make sure you're consistent in your message for those who are self-isolating. You know, that's the key thing. Really, really important to be consistent in your message for those who are self-isolating. That obviously they are sick. So yeah, in answer to your question about SSP, our understanding after Boris made that announcement was that payroll providers, people like Sage, probably went into freefall, going, right, okay, and so how do we change the code on Sage payroll so that SSP is paid from day one? How are we going to do that? Only when someone is self-isolating for coronavirus, because remember what Boris said was he didn't want people to be penalised for doing the right thing. So he was literally just talking about people who had been told by NHS 111 or a doctor to self-isolate. So he was not talking about Beverly who has migraines, or Jim Marie Cricket, or whatever his name is, who's got a football injury. They weren't talking about that person. They were talking about people who obviously were told to stay away from work and therefore be treated as sickness absent for 2 weeks. So what I suspect will happen is one or two things. Either that this will be when Matt Hancock introduces regulations, it will either be from the new tax year, so the 6th of April. And, you know, I think that might be dependent on what happens over the coming weeks and whether it needs to be brought forward. But yeah, 6th of April, I can see that happening. Or there might be a suggestion that, okay, you might need to make good those 3 days, but you don't have to do it immediately. Remember, the equivalent of, what do we say that SSP is? It's approximately £93. So let me just open up my calculator. So £93 divided by 5, 18.60 a day. So the equivalent of 18.60 a day could be paid by an employer at any point, whether it's done through the payroll system as SSP, or it's done as an additional payment and still tax. It could be made good at any point. But no, Vivian, I don't think it relates to any illness. And I sincerely hope it doesn't. But the other train of thought is that to make it simple, that it will be from every illness. And so if you don't want it to be for every illness, you do need to obviously make sure that the powers that be know how damaging that would be to small business if people didn't need to prove that they had been told to self-isolate. Because my understanding is, if you are told to self-isolate and you get evidence of such, that's what obviously gives you permission for sickness absence. You can't just basically, you know, tell the employer something that isn't back-upable, if that's the right word, in order to receive sickness absence pay. Because for some people, the difference between, you know, they earn 118 or more a week, say they earn £120 a week with yourself, they can get and eligible for, if they've got the service, £93 a week. It's not a big difference, is there, if you were a fraudster and that's how you rocked and rolled. So yeah, make sure you're consistent in your message. Ooh, how are we doing for time, folks? Oh, 8 minutes left. So yeah, don't think it relates to any illness, but yeah, it would be awful if it did. Let's hope that the powers that be realise that. I don't think the common payroll packages do. I think they are hard-coded, Keith, and I think, yeah, Sage Payroll probably went a little bit crazy at 12:45 yesterday afternoon, because I do think that's code for them to change things, and just why I think it might not happen to the beginning of the next tax year, when obviously they do have to do an update because of rates changing and what have you. If a member of staff chose to go to an at-risk country and they chose or advised to self-isolate and return, I think it'd be fair to say that they were nice and tasty to pay. Yeah, me too, Jessica. I mean, that's what I was saying a few minutes ago. You know, the idea now that Keith is saying that the news has broke that all of Italy, we have got a customer, I don't think she's on tonight, but she did say to me about an Italian member of staff who was going home for Easter to Italy. Would she need to self-isolate on her return? If what Keith is saying he's read is true, then yes, she would. And no, she wouldn't be paid. She would be obviously SSP, but she couldn't receive no pay. But I do think, you know, to go to a country in the future, if the result of your travel is that you're going to not be able to be attending work, that becomes an issue that I think we do need to look into as to whether that's reasonable, because obviously you're putting others at risk by doing that. So it'd be interesting to see how they work that. But yeah, Jessica, good question, but we probably do need to get back to you. So Jill, yeah, we can't necessarily give notice, Jill. I wonder if that's our Jill. If it is Jill, say hi. But yes, reasonable notice, you know, as much notice as you know that you need to with layoff, really. That's the thing. As soon as you know, let other people know. Isn't there a minimum we must pay to staff? Yes, it is. Yeah, you're thinking £16 a day. It's 29. You're absolutely right. Yeah, Alison, that's fine if it's out of date. At least you've got it in your contract, so don't worry. It's just a rate. It doesn't change every year. And as I say, I think it must have been about 24, 25 back in 2008 when we did use it a lot. But yeah, it's you know, absolutely, it's obviously it goes up, but I don't think it goes up with inflation or any of those other markers. Hiya, Jill, lovely to see you. Well, not to see you, but to know you're there. Yeah, can we ask staff to do a deep clean? Possibly. Again, staff might be willing to help. Many staff absolutely show their colours, don't they, in times of crisis. And you know, people's behaviour in times of a crisis never ceases to amaze me and impress me. You really see the right side of people, don't you, when we all have to pull together. So what other slides have I got? Yeah, so we might be able to help you if you do need any assistance. Obviously Red Wing Solutions is here for your service. So if you do need a copy of a coronavirus policy, you can buy one on our shop for just £9.99, including the VAT. If you feel that you wish to do more on your business continuity, business preparedness, in case this obviously does become a global pandemic as once described process, then obviously our coronavirus policy is there. Now that's obviously much more detailed than the simple coronavirus policy, but again, it's there for you to help you should that be something you feel you need. And those are available from Red Wing Solutions or redwing-solutions.co.uk/shop. Just pop the word coronavirus into the search bar and they will both pop up for you. Is that not going to click on? There we go. So again, if you want to work with us, if you need any assistance from us, we do HR, not duvets. If you don't know that reference to Swing Your Pants and the Saturday television show, I am sorry, but yes, we do talk a lot about we don't do duvets in Red Wing because we're all of that age, I'm afraid, all about Trevor and Simon. Retained HR support we do ad hoc support, so people can just pay for an hour's support over the telephone, over the internet and receive support, or they can pay for just a telephone call if that's what they need. So basically, you know, whatever you feel you need, whether it's ongoing support or just through this crisis, we have our shop and you can ring us on our Redditch number and speak to one of the lovely team who will be more than happy to assist you with any inquiry that you have. I'm going to ask that poll I'm going to do that poll for you in a seckie. Silly question. I've asked the question of the LA, but they cannot answer yet. Will we lose funding? I've heard that some people have been told they won't, but some people haven't been told. I think, again, I think it will be patchy and it could well be obviously on a local authority by local authority basis. Right, so let's ask another question. How do we do that then, Kiddywinks? Not relaunch polling. Do you think I can only do a polling after when we're not live? Is this only something I can ask a poll afterwards? Let's have a look here. You'd think you could do a live question, wouldn't you? Well, anyway, why don't we, because it's easy, in the chat, if you are planning to charge parents, why don't you type the word charge, and then Blue and I can add up numbers and do it that way, which is one way of doing it, isn't it? Yeah, if you're going to charge, just type the word charge, and then that'll give us a bit of a flavour and we'll be able to have a look. There's currently 33 of you on, so let's just see what that means. I'll have another slurp of my gin and tonic. I'm about to watch Downton Abbey with one of my other 47-year-old mates, because that's what you do when you're 47. Anybody want to unmute themselves? Have you enjoyed this evening? Obviously, you know, let us know if you found it useful. "15 messages, they're all going to say charge, aren't they? Yeah, I need to charge. I don't want to charge. No, nobody wants to. Yeah, not sure it'll allow you to. Depends how long. Yeah, I think it depends how long's a good answer. I mean, if you're told to close for a week, you might be able to cope with it, but if it becomes longer, it might become a real issue. I guess it's going to be difficult, isn't it, if you say first few days we don't and then after that we do, because you'll be changing the terms and conditions to do that. But I think for many of you, you'll have said, you know, if we are forced to close, you'll be charged, and that probably the bottom line isn't a bad way of putting it. Again, you could then decide not to enforce that charge, couldn't you, or give people the time back. Oh, very good in the capitalisation. Shouting Keith, thank you for that. So everyone's found that useful, yeah? Brilliant. Need to get to the wine. Yes, absolutely, you need some wine. I mean, another thing to make, and I didn't look at it tonight before I should have done really because I've run out of day, but do make sure you're claiming your employment allowances from from the government via your national insurance, your class 1 national insurance payments. If you're not sure what that means, speak to your accountant, but you really ought to be, where you're eligible, claiming for class 1 for employment allowance via the class 1 NI. Those of you that obviously aren't enormous, great big chains and having far too big a national insurance bill, but you know, always ask the question, am I claiming everything I should be claiming? Because obviously that's really important, isn't it? Oh, thank you. No, you're more than welcome, ladies, and you know, gentlemen, and thank you so much for joining me this evening. And as I say, hopefully you found it interesting and useful. And you know, if you need anything, yeah, you won't be able to claim if everything's government funded. Some of you won't be able to claim because of your constitution, your status, if you're a charity and that sort of thing as well. But if you are able to claim, obviously definitely ask the question if you're able to claim. Make sure you're getting everything you are eligible for as well. Accountants should pay for themselves through their advice and service to you, is always my feeling. But yeah, everyone have a lovely evening. And if you need anything, you know where we are. And you know, ultimately, I'll make sure that you get this recording so that you can add it to your group, Joe. Joe, I'm just going to unmute you and just check that you're happy. Whether I can, actually. No, I can't. Joe, if you want to just say if you're happy.
Hi, Imogen.
Hi, sweetie. Are you okay? Are you happy with that?
Yes, brilliant. Thank you so much.
No, you're welcome. You're more than welcome. And as I say, I hope the group's found it of use.
Yes. Hi, Hubsters. Thanks, Imogen. Take care.
Cheers, see ya. Bye-bye.
Cheers, bye.
End it.